This is Right to Life Radio. And now, here's your host, John Girardi.
We've got some unbelievably stupid legislation, SB 233. You heard about it, I think, last week or 2 weeks ago here on Right to Life Radio. And we've got some updates on it as it is moving its way, plowing through the California State Legislature. Jonathan Keller from California Family Council is here to discuss it with us.
Plowing its way through.
Plowing its way through. There we go. So, Jonathan...
This is why you never listen to the pre-show, folks.
No.
The pre-show is not recorded. So
a bunch of jokes about... Anyway. So, Jonathan is obviously, as CEO of California Family Council, that's Jonathan's role, is to... His organization does a lot of work overseeing... Well, not overseeing here, monitoring.
That's right.
Monitoring what is going on at the state capitol with bad state legislation, especially stuff that relates to abortion.
Overseeing would imply that we have some incredible powers of orchestration that I wish we had.
Yeah, I wish you could oversee things too. Basically, SB 233 is a ridiculous measure to try to... basically only to help out abortion doctors in Arizona. So, Jonathan, why don't you give the 2-minute summary of what the bill does?
All right. So I will read you here a tweet shared with me by my crack staff of Greg Burt, our vice president, and Sophia Laurie, our outreach director.
Okay.
This is SB 233, and the title is Practice of Medicine, Arizona Physicians, Abortions, and Abortion-Related Care for Arizona Patients. And I won't read you the whole text of it, but I'll just read you how Nancy Skinner, who was one of the co-authors of the bill, alongside Assemblymember Aguiar Curry, and sponsored by the Governor Newsom and the California Women's Caucus. This is essentially how she describes it basically. Excellent. The California Assembly Business and Professions Committee approved SB 233, urgency legislation by me and Assemblymember Aguiar Curry, sponsored by the Governor and the Women's Caucus, to allow Arizona doctors to provide abortion care for Arizonans in California. Vote was 13-2. Next stop, the Assembly floor. And then she goes on the next thing. She says, even though Arizona has repealed their draconian 1864 law outlawing abortion, SB 233 is necessary because the repeal won't go into effect until late October or early November. So essentially, John, California, our governor, is so deeply concerned, and the Women's Caucus are so deeply concerned about the abortion, quote unquote, needs of women living across the border in Arizona.
Sure.
They are so desperate that there would be no interruption in the ability of women in the lives of their children, that they are going to throw caution to the wind and say, look, are you an abortion doctor that lives across the border? Just set up a temporary clinic or come over here to California.
And you get temporary, like, California state medical licensure and the whole thing.
And John, I just want to point out the ridiculousness of something like this combined with similar bills we've seen in the past that are setting up all these abortion benevolence funds for people from around the country to come here. When people say, "Oh no, we're just wanting to support women. We're just pro-choice. We want women to be able to make the choice that's best for them." Well, unless that choice actually involves giving birth to the baby, because I can tell you what the website abortion.ca.gov, which is an actual real website,
that's an actual real thing, yeah.
What that website is not doing is offering scholarships for women in Alabama or in Arizona or in Mississippi, which, John, I'll tell you, I went to a meeting in Texas a couple of weeks ago. I heard some really startling and tragic statistics on the fact that, there actually are statistically significant racial disparities in maternal health care and in postpartum care and in prenatal care in certain parts of the South. And guess what? Even here in Fresno, California.
Yeah, exactly.
There are a lot of racial disparities. And I think as conservatives, we can look and say,
and we're going to talk about that a lot in the second half of the show, reading about Dr. Monique Chareau's piece on this in Newsweek.
Well, so I think this is a big picture thing, John, but I'm gonna get on my high horse, or not my high horse, my soapbox just a little bit here and say, I think that conservatives, and I realize we have liberals and progressives and Democrats and Republicans, we have all sorts of people that listen to the show, but I'll say sometimes conservatives can get very caught up and say, well, I don't like the idea of, systemic racism. I don't like the idea that there are, everybody can pull themselves up by their bootstraps and, everybody has the same opportunities.
Yeah.
Yes, I agree with that in theory, but it's also true. You look statistically, it's just true that people from lower socioeconomic status, and in some cases, people of color, quote unquote, to use the left's terminology, it is true that there are significant differences in outcomes for how those people sometimes receive healthcare.
Right.
And California,
and I think there are non-politicized explanations for a lot of these things, and the politicized explanations are often misleading and unhelpful.
Yes.
So,
yes. So I think, and that's an area where I think that the conservatives and pro-lifers especially should be able to look at this.
Right.
That's what I heard from this report.
And that's what the second half of this show, that's what that's all going to be about.
Like I think that if California had said, hey, you know what? We think that there is there are maternal mortality crisis that's happening in certain states. And we are going to say, hey, if you are, if they called it pregnancy.ca.gov or motherhood.ca.gov.
Or prenatalcare.ca. Yeah.
If they said, hey, we're going to set up these benevolence funds, and if you live in Alabama or Mississippi and you are
not able to get good prenatal care.
Yeah, you're at a risk. Like there's a sad, tragic likelihood that your child, because of either healthcare complications or because of your health situations, you or your child may die, or you may have a very difficult
let's set up a fund. Help you come to California. We'll take care of you.
We'll fly you all the way to California.
Or even if it's a thing of, okay, the San Joaquin Valley is one of the poorest regions in the country, not just in California.
Right.
It has a dearth of prenatal care provision.
Right.
Why don't we have a whole big expedited process for, Arizona, some posh OBGYN who's working in, what's a fancy schmancy part of Arizona? I don't know. Scottsdale, some fancy schmancy OBGYN who lives on a golf course in Scottsdale.
Right.
Hey, Doc, come to Fresno, come to, Sanger for 3 weeks and work at our clinic here and provide obstetric care to women who can't get care. That would be a wonderful program. Let's provide you with temporary licensure for that. But no, what we're doing is really, we're just focusing on abortion.
Right.
That's all we care about, really. We ignore the broader problems of high rates of maternal mortality for lower income women, for minority women. All we care about is abortion. And it's even more performative than I think at first blush, Jonathan, because of this thing. So the shadow producer of all John Girardi radio productions. Well, I have two shadow producers. Colton is the non-shadow producer.
Right. He is out of the shadows.
He's out of the shadows. The two shadow producers of this show and John Girardi show are my wife, Holly, and my mom, Dr. Sharon. So I was asking my mom about, what do you think about this proposal? Again, so we're talking about SB 233. SB 233, sorry. SB 233. This is to give temporary licensure to Arizona abortion doctors so that they can keep doing abortions in California until Arizona's repeal of its abortion law comes into effect in October, November. I was asking my mom what she thought about it, and she was like, that seems so silly, like to give temporary licensure. Well, she looked this up, and she found this. This is from the California Business and Professional Code. This is already law in California. The Medical Board from California Business and Professional Code, Section 870. The Medical Board of California, the Osteopathic Medical Board of California, the Board of Registered Nurses, and the Physician Assistant Board, shall expedite the licensure process for an applicant who demonstrates that they intend to provide abortions, as defined in Section 123464 of the Health and Safety Code. 123464 is of the Health and Safety Code is the thing that defines legal abortion in California, by the way, within the scope of practice of their license. So basically, they already have in place It's already was effective as of January 1st of last year. They already have a law in place with an expedited licensure process for doctors who want to come to California to do abortions. This whole law is seemingly kind of duplicative, and this is for show. That's all this is. This is Gavin Newsom and his willing pro-abortion accomplices in the legislature trying to show to their donors, trying to show to really, I do genuinely think it's donors. I think it's Gavin Newsom wants to run for president in 2028. He has all of these California socially super liberal donors who are they're not Bernie Sanders types. They're not AOC types. They don't like people reaching too far into their pockets, but they compensate for their lack of fiscal liberalism with a massive commitment to social liberalism. They love abortion. They love same-sex marriage. They love all that stuff.
And John, I'll tell you, I'll say the quiet part out loud.
Yeah.
He's also trying to appeal to squishy Republican women in Orange County.
Right.
I'm just saying.
Probably that's almost certainly true. Yeah.
Hey,
And
look, I know you don't like all the literal crap on the sidewalks.
Yeah.
I know you don't like this homeless encampments
But look
that
at
are
all this
down
cool
around
stuff I'm
Angel
doing.
Stadium.
Yeah.
But hey, look,
I'm doing all this stuff for abortion.
You can't put the Republicans in charge because they'll take away your abortion rights. Look what I'm doing for your cousins who live over there in Arizona. I'm the kinder, gentler Gavin
not for
Newsom.
anyone you know, but for all the brown people.
Yeah, that's right. That's right.
For all the people who cut your lawn.
Yes.
That you think the best thing you can do for them is abortion.
Exactly.
Rather than like actually helping them and actually
Yes.
loving them and actually caring for them.
Yep.
Yeah. So that's the amazing thing. My mom managed to find this. She's like, this is going to be super easy for them. Like, it's already practically done. They already have an expedited process
Right.
for abortion doctors to come to California to do abortions. So I don't even know why this whole thing is necessary other than as a show of, look how, hey, Getty family.
Mm-hmm.
Hey, the Willie Brown magic circle of donors. Hey, all you Silicon Valley leftists. Hey, or not leftists, liberals who like money, but also like socially liberal, societal engineering. Hey, all you guys, look at what we're doing to provide abortion to all these people. When we return, we'll talk a little bit about the focus here of how the baloney nature of the, quote, continuity of care arguments and how the only person this bill is helping is abortion doctors from Arizona. That's next on the John Girardi Show, on Right to Life Radio, a production of, as always, of Right to Life in Central California, rtlcc.org. Back with Right to Life Radio. All right, Jonathan, we're talking about SB 233. This is the bill to provide temporary, emergency, immediate licensure for abortion doctors from Arizona so that they can come to California and keep doing abortions while Arizona's anti-abortion statute remains on the books. Now, you and I have made the point that this is performative. There's already law on the books in California giving out-of-state doctors an expedited licensure process so that they can do, as long as they're doing abortions in California.
Right.
Not if you want to help deliver babies, not if you want to help provide critical emergency care. No, only abortions. So that's already on the books.
Right.
One of the dumbest arguments I've heard, and I was interviewed about this for a news segment that was on ABC 30 last week. Was it last week or 2 weeks ago? I was interviewed about it, and I sort of was trying to make my points. This was so stupid. The pro person who was interviewed was some doctor from UCSF Fresno. Naturally, because UCSF Fresno is like so pro-abortion, it's revolting. And what she was saying was, well, this is really important for establishing continuity of care, so that women from Arizona can continue their relationship with their doctor from Arizona when they have their abortions. This is painting a very rosy picture of the doctor-patient relationship when it comes to abortion care, abortion provision.
John, everybody knows that women who have abortions, statistically, they have a long-standing relationship with a single OBGYN.
Yeah, in a private practice.
That they've been seeing since high school.
With a very stable relationship. Yeah. So let's understand this. Approximately 93% of OBGYNs don't do abortions. Okay. Very few OBGYNs will actually do it. I think when you look at OBGYNs, there's the pro-life OBGYNs, a large percentage of them who are theoretically pro-choice, but don't want that actual literal blood on their hands. And then the OBGYNs who are actually willing to do abortions, of whom my late beloved dad always said that his opinion, it's just his opinion, was that they were real bottom of the barrel doctors, that's the only way they could make their money was doing something so horrific as abortion. And I suspect that he was correct.
Well, John,
as he was about most things.
This is this is very dark humor, but it's Right to Life Radio.
Yeah.
This reminds me of the classic Seinfeld episode about the dentist. What do you call a doctor that can't pass medical school? A dentist.
Yeah. What do you call an OBGYN who can't sustain like a real normal practice? An abortion provider.
Yeah.
Anyway, so there's very few doctors who are willing to do abortions. So it's not like to argue that, we need to let these abortion doctors from Arizona come to California to do abortions. The idea being they're going to follow their patient. All right. So you're telling me a woman who wants to get an abortion, one, that she isn't just going to the first random Planned Parenthood or other like clinic like that she can find to get an abortion, what percentage of women who are getting abortions are lower income and don't have an existing standing relationship with an existing OBGYN? If someone is in an existing standing relationship with an OBGYN in a successful private practice, odds are that person doesn't do abortions. And if they have a successful practice, they're probably not going to travel to California to do abortions. The only guys who are going to be desperate enough to actually go to California to do abortions are guys for whom, or gals, for whom that is 99% of their income, or a huge percentage of their income. Okay. So the idea that that this is providing continuity of care, because then the same doctor, you and that doctor will travel from Phoenix to Los Angeles. You will both go to the same clinic at the same time to have that abortion there with your same Arizona doctor, as opposed to any other doctor you might go to if you just drive to LA and go to the Planned Parenthood of Los Angeles. That's BS. The logistical likelihood of that happening
John,
is idiotic.
Let me give you...
It's not going to happen.
Let me give you an example from my personal experience, my family's personal experience, and you could probably share a similar one for you and Holly. I remember when we were in Fresno, just Fresno, one city, Fresno and Clovis, I should say.
Yeah.
We were getting ready to deliver our first son, Hudson, in 2017. And my wife had been with the incredible, amazing Dr. Amy Holmes for a while.
Right.
We were like, great, this is fantastic. We're so excited. She helped us with all of our initial pregnancy complications with, miscarriage and infertility and everything else. And we were so excited. Yay, Dr. Holmes is going to be able to be Julia's OBGYN throughout the entire pregnancy. She's going to deliver our baby. But guess what? Dr. Holmes got pregnant.
Right.
So all of a sudden, my wife's continuity of care no longer rested in being able to have the same doctor in the same city,
exactly,
in the same practice. So literally, Dr. Holmes said, hey, I'm so sorry. Obviously, we're very excited about this, but I know this is tricky for you. So I'm going to refer you to my OBGYN, the doctor who takes care of me and has taken care of me for, the time that I've lived here and helped with my pregnancies. So we got referred to this other, I think it was Fresno Women's Medical Group or whatever it was. So Julia gets referred there. We meet the new doctor there. I don't remember his name, but I also,
probably Stuart Mason.
I think it might have been. Yeah.
So right to life supporter, Stuart Mason.
Oh yeah.
So we like him. Yeah.
So we get referred to this practice, and Julia's like, well, okay, this is a little different. Haven't had a male doctor before, but we'll deal with this and everything. All right, that's fine. So the continuity of care was a little tough. Well, then we get to the time where Hudson is actually born. He is late. He's very late.
Yeah.
He was supposed to be born September 1st. By September 7th, he's still not here.
Yeah.
We go in, we do the induction. We were in the hospital, John. You probably remember this. It was for 4 days.
Yeah,
Before Hudson was born.
4 days before, and then several days after.
We went in on Sunday night, all day Monday, all day Tuesday, all day Wednesday. We're there laboring, all the different stuff. Well, guess what, John?
Yeah.
Surprise, surprise. That doctor was not the doctor for all 72 hours of my wife's care.
Yeah, and because that's the thing. When you're with an OBGYN, you're with a practice group.
Right.
And you see that OBGYN for your appointments in the lead up, or at least some of your appointments in the lead up. But there's no guarantee that that's the doctor who's actually going to deliver your baby.
They could be with another patient.
Yeah.
They could be on vacation. They could be sick.
Yeah, they could be taking care of other patients.
So the joke for us was that by the time Hudson was actually born, I think we had cycled through every doctor at the practice.
Except for him. Yeah.
Exactly. I mean,
exactly.
it was literally 3 or 4 different OBGYNs, and they were all great. They were wonderful people.
Yeah.
Dr. Icadello, I think, was one of them at one point.
Yeah.
I mean, there was, but the point being that there is no guarantee to continuity of care, even in an actual, hey, you're about to deliver this baby and it's a potentially high-risk pregnancy. So just the farce of the idea that abortionists are so committed to individual patients that they're going to fly interstate to do one of these abortions.
Yeah, it's idiotic. There are only 2 groups that are being helped by this legislation. One is abortion doctors in Arizona who don't have enough of an existing normal OB practice in Arizona to weather, abortion being illegal for the next couple of months. And 2, Gavin Newsom's electoral prospects. The Gavin Newsom for President 2028 campaign. Those are the only 2 people that are helped by this legislation. It is pointless. It is silly. When we return, we're going to talk about the actual prenatal care needs of women, how abortion may actually be contributing to maternal mortality rates. We'll read a great piece from Newsweek Opinion written by Dr. Monique Chereau-Webenhorst next on Right to Life Radio. Right to Life Radio, John Girardi here. This is Jonathan Keller from California Family Council.
That's me.
This is, I think, the best thing I've read on the topic of abortion and prenatal care in a really long time. And to the point where actually several of our Right to Life staff were out on vacation late last week. So I'm actually going to send it to everyone as required reading for the whole Right to Life staff and for everyone at Obria. This is a piece that was published in Newsweek Opinion, and it's written by Dr. Monique Chereau-Webenhorst, who is fantastic. She's female OBGYN, African-American female, super pro-life. She's an advisor for, I learned of her through Notre Dame. She's a senior public policy fellow for the Notre Dame Center for Ethics and Culture. And she had worked for the VA and the U.S. Agency for International Development, USAID, I think that was chiefly during the Trump administration, and she was able to promote lots of pro-life policies through those entities. And she has a ton of experience in women's health care, prenatal care. And one of the things she's been looking at is the topic of maternal mortality among minority women, which is very often presented first of all, is a real problem.
Right.
So,
and John, to that point, I know we said it in the first segment, but conservatives should not just automatically dismiss it because they go, well, that sounds like something woke that a woke person would say.
Right.
I don't like CRT, and I don't have okay. I agree, but just take a deep breath.
Yeah. So she's pointing out, one of the first things she's pointing out, according to CDC data, the maternal mortality rate among Black women in America is 2.6 times higher than the rate for white women.
So, John, not 2.6% higher.
2.6 times.
So like 260%.
Correct. Yes. Yeah. So the likelihood of an African-American woman dying around childbirth is 2.6 times more likely to happen than a white woman. Now, a lot of that has to do with socioeconomic things. What the point of her article is, the reasons that are given often for this discrepancy in healthcare outcomes are often driven by political narratives in ways that are not really helpful and are maybe not really getting to the root causes of the disparity in outcomes. Now, often the media will present this, and the implication that's given, or the flat out argument that's given, is that African American women have these worse outcomes because of racism.
Right.
That doctors don't take African American women's health care seriously, and that therefore these bad outcomes come. What Dr. Webenhorst is saying here is that she's not necessarily sure that that's true. And one of the things she points to sort of there are three different explanations that are often given: racism, climate change, and lack of access to abortion. Those are the three things that are often given as the explanations. Now, let me read some of what she has to say. When explaining this higher mortality rate, identity politics quickly becomes a roadblock to helping minority women survive pregnancy. Well-intentioned individuals in media, healthcare, and government frequently cite climate change, lack of access to abortion, and systemic racism as causes of these tragic deaths. In doing so, they fail to deeply consider the existing data on this important issue. The truth is that there are at least as many risk factors that contribute to maternal mortality as there are misleading theories for the disparity, each affecting different groups in different ways. Research shows that a higher proportion of African American women, for example, pass away from clots in their lungs or pregnancy-related hypertension compared with white women, while a higher proportion of white women die from stroke or infection compared with black women. Likewise, more Hispanic women suffer from fatal hemorrhage than black or white women. So one of the things she's pointing out is that it's not that people are all dying of the same things. Different groups are dying from different kinds of things in ways that would suggest maybe there's something going on here other than just flat out racism.
Right.
Okay. Maternal deaths among minority women may also be caused by underlying risk factors unrelated to their ethnicity. Medical studies consistently show that women of all backgrounds who give birth at an older age, for example, are at higher risk of complications. Mental health conditions are a significant contributor to maternal mortality. A review of data from 14 U.S. states revealed that mental health conditions were the leading cause of pregnancy-related deaths. In the state of Indiana, white women account for nearly 90% of maternal mortality deaths attributed to overdose. Despite the wide array of conditions and behaviors responsible, minority women are led to believe that greater access to abortion is the solution to preventing maternal death. Nothing could be further from the truth. And this is the part that, obviously, for us at Right to Life Central California is so important, but also given that, we have our Obria clinic that's serving lower income women. This was, I think, so revealing. An 8-year study of California Medicaid recipients, so Medi-Cal patients, 8-year study of Medi-Cal patients found that in the year following an abortion, a woman is 162% more likely to die from all causes than after childbirth.
Wow.
So for all the people with the whole, abortion is safer than childbirth argument, no, not true. Abortion is more than twice as dangerous as childbirth. It also revealed that after abortion, mothers are 182% more likely to die in an accident and 254% more likely to commit suicide. 254% more likely to commit suicide. One study even noted that after gestational age at abortion, the most significant risk factor for death associated with abortion was ethnicity. Women of color are 2.4 times as likely to die from abortions as white women, a fact that mirrors the black-white disparity in childbirth mortality. So this is the thing. Liberals assessing this problem who want to inject racial identity politics into the problem of high maternal mortality rates for African American women, I don't know that you can have your cake and eat it too here. If you're going to say that the reason why maternal mortality rates are 2.6 times higher for black women than white women is because of systemic racism, then clearly the same systemic racism infects the abortion industry as well. The clean and pure as the wind-driven snow abortion industry, the heroes of America saving women's lives with a procedure that makes you, that it appears involves women being this much more likely to die of suicide, this much more likely to die of any cause, and women of color are 2.4 times as likely to die from abortion as white women. These data, Dr. Webenhorst continues, suggest that abortion itself may be a factor contributing to maternal mortality among minority women. Let me repeat that. Abortion itself may be a factor contributing to maternal mortality among minority women, as black women have undergone induced abortion at a rate 4 times that of white women for the past 3 decades.
So you basically, in other words, what study we need is to see what are the death rates if you factor out abortion. If you take out, then you say for women that have never had abortions, both black and white, how do their maternal mortality rates compare?
That would be a really interesting comparison point.
But that would be pretty damning, I expect, for the abortion industry to realize that it is so incredibly pervasive that this thing that is being pushed into the minority community, the black community.
Women of color need abortion. How many sloganeering, how often do you hear that slogan being pushed out by the president of the United States?
Right.
No less.
And the idea that as a result of this thing that is being hyper promulgated, you are going to see directly worse health outcomes.
When we return, I'm going to take this up. When we do and don't see racist dog whistles in American society, and why we don't see it when it comes to abortion. That's next on Right to Life Radio. Right to Life Radio, we're reading this excellent piece by Dr. Monique Chereau-Webenhorst from Newsweek. Dr. Webenhorst is an expert on OBGYN care and OBGYN care among minority communities and lower income women, and is pointing out that there is pretty strong arguments to be made that abortion is actually pretty strongly correlated with the higher mortality rates that African American women suffer, and that minority women in general suffer over and against white women. Now, she points out again that African American women are 2.4 times as more likely to die from abortion as a white woman who undergoes an abortion, and that it might have something to do with the fact that African American women have, for the last 30 years, had abortions at 4 times the rate of white women. Now, this leads me, Jonathan, to think about the question of when is something a racist dog whistle and when isn't it? So I had this example. So you're familiar, Jonathan, with the basketball player Giannis Antetokounmpo.
I am.
Okay.
The Greek Freak.
The Greek Freak,
from the Milwaukee Bucks.
But be careful, Jonathan. If you call him the Greek Freak and avoid saying his very long and difficult to say for native English speakers from America last name,
yes,
you may be engaged in a racist dog whistle. This argument was made so Giannis Antetokounmpo, for those who don't know, former MVP of the National Basketball Association. He won the 2021, I believe, NBA championship.
Very inspiring player. I mean, up from
poor background in Greece. Mm-hmm. I think originally of African heritage. Nigerian heritage. His family moved to Greece. He was living very poor in Greece and made himself into this amazing basketball player. There was a school of thought among some sports media people who are even more left-wing than normal media people, I contend, sports media, that broadcasters who would refer to Giannis Antetokounmpo as just Giannis or as the Greek Freak, some of whom were doing that to avoid saying his last name, which was for some people difficult to say, especially when he was first coming onto the scene. Difficult to say, has a lot of syllables in it. That was racist, that it's racist to not put in the necessary effort to learn and pronounce correctly his last name, that was racist. Now, that seems to me like a stretch. I bring it up, though, as an example of the left is so willing to find evidence of systemic, unconscious racism, even in things like, this, like a basketball player with a complicated last name, or a difficult to say for native English speakers last name that has a lot of syllables. And yet, for some reason, we can't find anything, even a tiny bit racist, about African-American women for the last 30 years having abortions at 4 times the rate of white women. There's no hidden agenda with the abortion industry, an industry that was founded chiefly by a woman who was an open, avowed racist, who didn't want African Americans to have a bunch of kids because she was a eugenicist and thought African Americans were lesser than, who promoted birth control specifically to African American populations, who believed that it was good for the government to forcibly sterilize certain kinds of people who were stupid, in her eyes, stupid. We don't see anything racist there. We don't see anything correlative between, again, abortion rates 4 times greater than white women among African-American women. Nothing racist at all about that. And nothing that connects between that and 2.6 times the maternal mortality rate.
So, John, I'll tell you that study that I mentioned earlier in the show, when I was at this pro-life thing back in Texas, they pointed out that in many cases, the black women who are facing these incredibly high rates of maternal mortality compared to white women, and also all these other very tragic health outcomes, as well as very high abortion rates historically, they were pointing out the fact that in these communities, in a lot of poorer black communities in the South, Planned Parenthood is the first and only healthcare provider for these places. And in some cases, they are multi-generational.
Yeah.
The only healthcare provider. So They were saying that when they did these studies, they found out it's not just that the 15, 16, 17-year-old black women that are getting abortions are, well, my only OBGYN, my only doctor maybe that I've seen since my pediatrician well visits, the only doctor is Planned Parenthood. That was my mom's only doctor. And in some cases, that was my grandma's only doctor was Planned Parenthood. So, John, in my mind, that actually makes it even more damning, because if Planned Parenthood is the one complaining, look at these horrible health outcomes, you've been the primary provider for 3 generations.
And let me ask you this, if there's a Planned Parenthood clinic in a minority community in the South, it's getting sustained in no small part by charitable donations. Oh, by totally not racist charitable donations from totally not racist white people from the South who, what are they contributing to? A clinic that provides family planning for African Americans, but not prenatal care. That's the thing. Like, Our Obria clinic does prenatal care for lower income women. We want these people to have their babies. We want these people to be taken care of. What's more charitable? Helping lower income women have their babies, which data indicates 70% of women who have abortions would rather have their babies if they just had enough support and care and finances to do it. The donor dollars that are going to those kinds of clinics, what are they really supporting?
Right.
What are they really supporting? There's no hidden agenda there. There's no racist dog whistling there. That'll do it for Right to Life Radio. We'll see you guys next time on Power Talk.